Knock, knock. Can I come in? Yes. Hi, my name is Geneviève Ruma. I am a nurse student at Montgomery College. I'm going to be doing the bedside assessment on you today. Is that okay? Yes. Okay, thank you. I'm going to go ahead and provide some privacy, gather all the equipment that I need here, and then wash my hand, okay? I also going to make sure the bed is really set up the way it is and that you are comfortable where you are. Are you comfortable? Yes. Okay. Can you tell me your name? John Smith. Okay. How do you want me to call you? John. How about your date of birth? November 22, 1959. Okay. Thank you. So, in this assignment, I'm going to be asking some questions, okay? Don't feel like bothered. Don't be overwhelmed. Just try to answer as much as you can because this is the part of this assessment, okay? Okay. So, the patient is comfortable, the patient posture is good, the mood is fine, the patient is the speech is fine, the patient is well dressed, like according to the weather outside, the patient is clean and well dressed. Okay, so Mr. Smith, can you tell me where you are? I'm at the hospital. Do you know which hospital? Holy Cross Hospital. Okay, do you know today's date? Yes, today is February 5th, 2021. Do you know what brought you here today? Yes. Can you tell me? Yes, I have difficult breathing and I have a heavy pain like something is sitting on my in middle of my sternum right here. Okay, thank you. The patient is alert and oriented. Time 4. Okay. Now, since you told me about this feeling here, when is this started? This start this morning. Okay. How regular is that one? Is like frequent or is it comes ago? It's really frequent. It's constant. Okay. How is it? Can you describe it for me? Is it sharp? No, it's just like heavy. I can feel like something is sitting here. Okay. Are you on any medication? Yes, I'm taking the inhaler. Is the medication is albuterol inhaler. It doesn't help at all. No, it doesn't help me at all. Okay, so from the scale of 1 to 10, of 0 to 10, can you tell me 0 being like you don't have nothing and 10 is the worst? Where is your feeling, your pain? Where is that feeling? Is 8. Okay, now can you tell me how is it, sharp or dull? It's really sharp. It's that heavy here. Okay, thank you. Also, how is it? Is it severe? Yes, it's very severe. Do you think it's related to something? Yes, I think it's related to the fact that I have that short of breath. Okay, thank you. Now, are you allergic to something? Yes, I'm allergic to the NKDA. Okay, now uh, I'm gonna go ahead and take your viral sign. Okay, the viral sign is been taken. The blood pressure is 115/68. The heart rate is 88. The respiration is 22. The temperature is 98.6 Fahrenheit. Okay, now how is your sleep? I don't sleep at all just because I have this like difficult breathing. Okay, are you anxious? No. Do you have any stress? No. Who do you live with? My wife. Is it your support? Yes, but I also have 2 children that they don't live around. Okay, thank you. Thank you so much. We're gonna go ahead and just start our assessment, okay? I'll start with the head. So do you feel like, do you have any headache? No. Any dizziness? No. No headache, no dizziness. Okay, the head is symmetric. I can see the hair, it doesn't drop side to side. I can see the scalp. The scalp is nothing on the scalp, like no bump, no masses visible, no bruise, nothing. Okay, and then the head, the skin of the head is like well distributed, is the color is fine. Okay, now I'm gonna go ahead and do your eyes. Okay, so I'm gonna ask you, do you have any problem with your vision? No. Do you wear glasses? No. Okay. Your sclera is white, your eyebrow and your eyelashes are intact, full. There's nothing like missing. I'm gonna go ahead and check your cranial nerves. Okay, I'll check your cranial nerve 3, 6 and 2. Okay, so with first one, I'm going to check your external ocular motor. Okay, so you're going to look, feel like follow my pen. Okay, just for the movement. Okay, everything is okay. Your external ocular motor is intact. Then I'm going to check your pupils. Okay, so I'm going to just flash in your eyes, and no, it's like is uncomfortable, but I'll try not to put the light too much. Okay, so just look at here. Okay, your pupils are equal, they are round, react to the light and accommodation, which is very fine. Now I'm going to go to your ear. I'm going to check. Okay, do you have any problem hearing? No. Okay, I'm going to access your gross ear. Okay, so can you hear me? Yes. Can you hear me? Yes. Can you hear me? Yes. I'm going to access the external hearing, which I can see there's no bruise, there's no rashes, there's nothing like that. It's intact. Now I'm going to look in your ears. Okay, so when I look in your ear, I didn't see any bump, I didn't see any bruise, I didn't see any drainage. Your ears are intact, which is good. So I'm going to go now and go to your mouth. Okay, so do you have any problem eating? No. Okay, how about your teeth? Do you have any problem with your teeth? Nothing like that. Okay, so I'm going to look in your mouth. Can you open your mouth for me? Okay, so the uvula is in the middle. The mouth mucous are like moist and pink, and your tongue is moist and pink. Your palate are good, is good, is moist, and the gum are not bleeding, which is fine. And now the teeth are intact, there's no missing teeth. Okay, I'm going to access your cranial nerve 10 and 12. Okay, so can you open your mouth for me? Can you say ah? Yes, ah, ah. Okay, can you swallow for me and tell me if you have difficulty swallowing? No, I don't have any difficulty swallowing. Okay, your cranial nerve 10 and 12 are intact. I'm going to go to your neck now. Okay, the neck is symmetric, the skin color is nice, is appropriate for the ethnicity, the skin is well distributed, and the trachea is in the middle. There is no mass, visible mass. Okay, which is good. Now I'm going to go ahead and check your chest. Okay, so do you have any difficulty breathing? No. Oh, no. Do you have any difficulty breathing? Yes, I'm having difficulty breathing. I'm feeling like something heavy on my chest. Okay, how do you cough sputum? No, I don't cough any sputum. Okay, so your chest is symmetric, the hair is well distributed, there is no sign of labor breathing, so the work of breathing is fine. The chest wall is symmetric, the epidiameter is 2:1, and now I'm going to go ahead and auscultate. Okay, so I'm going to auscultate right here. I'm going to do with the anterior one. Okay, and then you're going to take a deep breath every time I do it. Deep breath, deep breath, Deep breathe. I'm sorry. I'm gonna start. Deep breathe. 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 I'm gonna go to the posterior one, okay? So I'm gonna do the posterior. You don't need to deep breathe, okay? To take a deep breath. Okay. Right here, right here, right here, right here, right here, right here. Okay. I'm gonna do the lateral one, okay? Right here and right here. Okay. And like I can see that the chest wall, like I can see I can hear the wheezing in your chest wall, okay? It's really wheezing. The posterior and anterior one is wheezing, okay? So now I'm gonna go to the heart, okay? So do you have any chest pain? Yes. Okay. Do you feel like are you any chest pain? Yes. Any like dizziness? No, not dizziness. Any palpitation? No, no palpitation. Okay. Now I can see your heart. The hair is well distributed. Everything is symmetric. There is no visible like pulsation. I didn't see anything like that. Okay. So I'm gonna go ahead and auscultate. Okay. So right here I'm going to do the second intercostal, which is aortic, the aortic valve right here. I'm going to go here to the pulmonic, second intercostal. Then I'm going to go to the Erb's point, which is the third intercostal. I'm going to go here the tricuspid, which is the fourth intercostal, and then I'm going to go here to the mitral, which is the fifth intercostal, and then right here in the apical, well, that was the apical and the PMI. So I didn't hear any murmur, I didn't hear anything like that, so everything is fine. Now I'm gonna go ahead and do the stomach, okay? So do you have pain? No. Before even that, I'm gonna look at your stomach. So I'm gonna see the umbilical is in the middle, the contour is round, the hair is well distributed, the color is nice according to the ethnicity. There's no visible pulsation, and everything is fine. Then I'm going to go ahead and auscultate, okay? So the 4 quadrant, okay? I'm going to start with the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Okay. The bowel sound is intact. The bowel sound, I can feel the bowel sound. There's nothing. The bowel sound are there, and also there is no guarding. Okay. So also I forgot to ask you, do you have any like, how is the bowel movement? When is the last time you have the bowel movement? Yesterday. Okay. So how was your bowel movement? My bowel movement was normal. Normal. How about your the stool? The stool, like, did you see any blood in your stool? No blood in my stool. Okay. How about your urine? Are you urinate frequently? Yes. Normally, yes. What is in your urine? Your urine is normal. Yes. No bleeding. No bleeding. And also the color, how's the color? Amber yellow, normal color. Okay, which is good. I auscultate. Okay. Now, do you have any pain? No. Okay. I'm gonna go ahead and palpate. Okay. I'm palpating to see if there's any tenderness. no tenderness, okay, no distension. I didn't feel any. The stomach is really soft, which is good. Now I'm gonna go ahead and do the peripheral, peripheral vascular, okay. So do you have any tingling, any numbness? No tingling, no numbness, okay. So that the hair color is fine, the hair is well distributed, there's no edema. I didn't see any edema. Now I'm gonna go ahead and do your the skin tugger. The skin go back less than 1 second, and then I'm gonna do the capillary refill. The capillary refill go back, the refill less than 3 minutes, and then I'm gonna go ahead and see your AP diameter is less than is 2 to 1, which is good. That is very good. Now I'm gonna go and check it. I'm gonna palpate for your pulse for 1 minute, okay. I'll start with the radial pulse. Let's do the radial one for 1 minute. Your pulse is normal between 60 and 100, which is 62. And then I'm going to do the brachial for 1 minute too, okay. Here inside the brachial one, yes, I'm going to palpate the brachial one. Yes, 75 minutes, which is good, between the normal. And then I'm going to do the posterior tibial one, okay. I'm going to do the posterior tibial one for 1 minute, normal 85. This is good. I'm going to do the dorsally pedis, switching the two first toe, okay, normal toe, which is good. Now I'm going to go ahead and do the integrumanti, okay. So do you feel any irritation? No irritation. Any itching? No itching, okay. And also I'm going to feel the temperature. The skin is warm, the hair is well distributed, the skin is warm. I can feel it. Everything is fine. I didn't see any bruiser, I didn't see any wound, I didn't see any lesion, anything like that. So the skin is very intact, it's fine. Now I'm going to go ahead and do the musculoskeletal one. Do you have any problem with your mobility? No. How are you how is the level of your exercise? How long you exercise per week and how many times? I exercise 3 times a week and like for 30 minutes, which is good. Good. You exercise. And how is your joint? Do you feel like the joint pain? No, there's no joint pain. How about the deformity? I didn't see any deformity, which is well. Now we're going to do the range of motion, okay. So I'm going to be doing the passive range of motion, okay, on you. So can you squeeze my hand harder? Squeeze it, squeeze it, squeeze it. Okay, we're going to exercise your shoulder. Can you extend? Good. Can you extend? Good. Now we're going to go the hand, okay. So go ahead. Extension, yes. Flexion, good. Extension, flexion, extension, flexion. Now do abduction. Adduction, abduction, adduction, abduction, adduction, abduction. Now in rotation, out rotation, in rotation, out rotation, in rotation, out rotation. I'm going to do the hip now, okay. So do your hip. Just do extension, extension, extension. So now do in rotation, out rotation, in rotation, out rotation. Now we're going to do the leg, okay. So extension, flexion, extension, flexion, extension, flexion, extension. Now adduction, abduction, adduction, abduction, adduction, abduction. We're going to do your finger, okay, your toe. So do flexion, extension, flexion, extension, flexion, extension. Now push harder on my hand. Push, push, go harder, push, Whoa, push harder. Okay, good. Now we came at the end of our assessment. Thank you so much, Mr. Smith. Thank you very much. And I'm going to go ahead, okay, and call the doctor and tell him everything we did today. I'm going to notify him about what we're feeling right now so that we can take good care of you as soon as possible, okay? So is that anything you need me to give you, like water? Are you comfortable? Yes. You don't need water? No, I don't need water. Okay. I'm going to give you a call light so that you can call if you need something, okay? And I'm going to lower this bed where it was so that you can be safe, okay? And then I'll go ahead and wash my hand. Thank you so much, Mr. Smith. And I see you very soon. Thank you.